and also we have less beds available in the public in what I would call community hospitals. And again, I'd be remiss of me to speak on this issue without mentioning the farcical situation in relation to Abbott's Hospital and St Bridget's Hospital in Shane Portlaoise. These were community hospitals. Abbott's could have up to 50 people there, and the government has decided, and your predecessor, Minister Riley, decided, he announced his closure, is still not closed. He's not admitting any, no people are being admitted there other than on a respite basis. There's an attempt to close the hospital, and for a modest amount of money, you could bring that up to HICWA standards and have 50 people in that hospital at a reasonable cost to the Irish taxpayer. But there's a choice here to outsource care of the elderly. The same is happening in relation to St Bridget's Hospital. And I'm asking the Minister, again for the umpteenth time in the Chamber, make a decision and announce once and for all that you're going to upgrade the two hospitals. They're there, they can provide facilities. It would be a scandalous waste of resources not to utilise the facilities there, and for a small amount of money upgrade the facilities that could be there. I mentioned at the beginning, why are we in this situation? We're in this situation, and let's not get away from it, because of government choices, because of the government budget. And it's ironic that it's happening here in the beginning of January, but here in the middle of October the government came in and made their choices. The government could have given more money for hospital beds, but no, they decided to give it to tax cuts for the wealthy. The government decided they could have given more money to the crowded A&E department, but no, they decided we'll give tax cuts to the people on the top income tax rate. The governments could have decided we will give more money for outpatient appointments, but said no, we want to look after the best well-off in society and give a tax cut of 1% to those on over 70,000. The government could have decided to give more money to get people on the consultants waiting list, but decided no, we will give tax cuts to the wealthy. The government could have decided to reduce the waiting time for people waiting for elective surgery, but no, the government decided tax cuts for the wealthy, and those over 70,000 benefited more from the recent budget than anybody else did. Or they could have decided to lift the cap on the fair deal, but no, they decided we'll give tax cuts to the wealthy and those over 70,000. They are getting their tax cuts in their pay packet today. Meanwhile, the hundreds of people are sitting on their lying on their A&E trolleys.